All right. Hi, everyone, and welcome to this special webinar on tuberculosis on World TB Day, hosted by Partners in Health, along with support from TB PPM Learning Network and many other partners, donors of PIH and supporters of PIH as well. My name is Madhukar Pai. I'm a professor and chair of the Department of Global and Public Health at McGill University in Montreal. I'm a long-standing tuberculosis researcher and advocate, and I'm delighted to introduce the panel. We are recording this webinar and we'll share the recording later as well. So first off, we have Handaa. Handaa Enkh-Amgalan is a tuberculosis survivor, an advocate, a champion, and author of the book Stigmatized, A Mongolian Girl's Journey from Stigma and Illness to Empowerment. Thank you for joining us, Handaa. Next up, we have Vidya Krishnan. Vidya is a journalist from India, where she has been an author on contributing to several magazines and newspapers, including The Hindu, Caravan, and more recently for New York Times and other media outlets. She's the author of the book, The Phantom Plague, How Tuberculosis Shaped History. Thank you for joining us, Vidya. And then we have Dr. Melino. Melino is an executive director of Partners in Health in Lesotho and an infectious diseases expert and a wonderful PIH colleague. Thank you for joining us, Melino. And then we have Maria Smilios. Maria is an author based in the United States. Her recent book, Black Angels, The Untold Story of the Nurses Who Helped Cure Tuberculosis, is an excellent new contribution to the TB literature from the perspective of how it unfolded in the United States in the past. In addition, we had John Green, who was planning to join us, but John, unfortunately, is super busy traveling all over the United States doing a book tour. So he's actually in the middle of a book tour right today. But we will share a short video clip from John soon. John's book just came out on March 18th. His book is titled Everything is Tuberculosis. John is also a trustee of Partners in Health. So that's basically the structure of the panel. So to get us going, I will just say a few introductory remarks about where we are and at this moment in tuberculosis. I must say this World TB Day, it's very hard to feel joyful in any way because things are not happy or joyful by any means. I feel like I have this deja vu that we are kind of back in the COVID emergency, during which time we saw a precipitous fall in TB care coverage in many parts of the world. Everybody had diverted their attention to COVID-19 and TB services were suffering, and we had dire predictions about how big a setback it would be for TB. And I feel like we are in a similar state of emergency again. Not only is COVID already back as the world's leading infectious killer, killing almost 1.3 million people a year, we now have an extraordinary crisis because the United States government's abrupt ending of aid funding for TB research, for institutions that work on tuberculosis, such as the World Health Organization's Stop TB Partnership, funding cuts to PEPFAR, which is critically important for HIV services. I think all of this have led to like a perfect storm that is about to derail another huge chunk of TB care and services, putting us back in a similar kind of emergency that we saw during COVID-19. For example, WHO just released a statement that they are tracking service disruptions in multiple parts of the world. Already 27 countries have reported significant disruptions in health and TB services, with no surprise, Africa being top of the list because many countries in Africa were dependent heavily on US aid and other US government funding sources. 9 countries have disrupted drug supplies for TB supply chain. And we are all terrified of the Global Drug Facility, which is housed within the Stop TB Partnership, because that initiative was also funded by the US government, is now at risk. TB trials have been stopped and paused because they were either funded by USAID or NIH. So TB research is suffering as well. And more recently, about a week ago, a modeling paper just got published on what all of this funding cuts could potentially do to TB. And the modeling suggests that TB deaths could increase by 2.2 million under the worst case scenario assumption. And the worst case scenario, I think, for all of us would be not only is the US government funding going down through USAID or PEPFAR, but also US government pulls out of the Global Fund, which is a huge funder of TB care. So this is truly an extraordinary crisis for all of us working in TB. And it's impossible to not talk about these sorts of issues. So I will first play a short video where John Green was asked a similar question on CNN on what he thinks the impact of the US funding cuts would look like. And then I think we can go ahead with the rest of the panel and react to this crisis from various perspectives and then continue with the discussion. So with your permission, I will share this short clip. Please let me know if you can see the entire video clip and hear the audio as well.
Last couple of months, we've seen an enormous retreat from the US government in terms of tuberculosis treatment that we help fund worldwide. What do you think the consequences are going to be of these actions?
The consequences are already profound, and they will become even more profound over time, unfortunately. The United States has long been the most generous supporter of the fight against tuberculosis and a key ally in every country that's fighting the disease. In a country like Sierra Leone, without USAID money, thousands of people are losing access to their treatment. Hundreds of thousands of people are seeing their treatment interrupted, which means skyrocketing risks of increased drug resistance. We know that having drug-resistant tuberculosis circulating in communities is very bad news. It's bad news for individuals, but it's also very dangerous for social orders as a whole, because we can eventually get a form of tuberculosis that no longer responds to the tools that we've developed to fight it. That's scary. That should scare us. And it is devastating to watch this unfold. I mean, I never imagined I would be publishing this book in a time where it's so timely. I never thought the world would be talking about tuberculosis, but it is, because unfortunately the machinery that we use to get TB treatment to people has just ground to a halt as a result of these spending cuts.
So there you have John Green expressing his dismay at the state of affairs. John actually just published a piece in the Atlantic magazine where he wrote that the US government's actions will make tuberculosis untreatable again. We truly are making TB great again at a time when we should have ended TB. And this is the tragedy that we are faced with at this point. So I want to begin with Handaa because she is active in the WHO Civil Society Committee and has in constant touch with large number of TB survivors and advocates from around the world. What do you think, Handaa, is unfolding on the ground in high TB burden countries, and what are you hearing from TB survivors and civil society groups about this crisis?
Yeah, thank you, Madhu. First of all, I want to begin by expressing my gratitude to the PIH team and the TB PPM Learning Network for providing this space to share our experiences and speak at this pivotal moments in the fight against tuberculosis and the wider global health ecosystem. In my view, today we are standing at a critical juncture. 2 years ago, I spoke at the UN high-level meeting where global leaders all pledged to end the TB epidemic. We all set ambitious targets and committed to mobilizing at least $22 billion annually by 2027. Yet, as of 2024, 74% of this target remains unfunded. with similar shortfalls for TB research as well. And the expected 2025 and the ongoing 2025 funding cuts already further threaten this gap for the global TB response and the global TB community, pushing it to the brink of collapse. To illustrate the impact, as Dr. Madhu mentioned, the recent funding cuts have already hit more than 27 countries across 6 regions, leading to critical challenges on the ground. I hear from my colleagues in the task force that staffing cuts among healthcare workers are already happening, which means services are being interrupted, where TB patients are receiving their drugs and other life-saving services. Severe disruptions to diagnostic services are already happening, which means detection and treatment rates are being delayed. Data and surveillance systems are also being impacted, which means this is preventing us from tracking and managing TB effectively. Community engagement, which is a key pillar of fighting stigmatization and improving diagnostics and treatment rates as well, is also impacted, including active case finding, screening, contact tracing. This all means that diagnosis is being delayed and transmission is increasing around the world. So without urgent intervention, these systemic failures will only increase the spread of TB and worsen this global health crisis. And as Dr. Madhu pointed out, we made a similar mistake a few years back. During the COVID-19 pandemic, disruptions in TB services caused 700,000 excess deaths, and that is 700,000 lives lost to a disease that is both preventable and treatable in this current century. And we cannot allow history to repeat itself. And especially for me, these numbers are not just statistics, those 700,000 excess deaths, because these are very personal to me. I'm a TB survivor. I have lived through the fear, the stigma, the toll that this disease takes, not just on the body, but on the spirit. And one of the biggest fears I remember during my own treatment was the possibility of drug discontinuation, because I knew that if I interrupted my treatment, drug-susceptible TB I had could turn into drug-resistant TB. And as we know, drug-resistant TB is a much harder to treat and often fatal form of the disease, that it can take up to 2 to 3 years, for example, to complete the treatment process. So for me, that fear was just a possibility, and luckily it did not happen for me. But today, due to funding cuts that are so abrupt, the next morning, the TB patients cannot receive their drugs. It's the grim reality for them. So we are talking about a matter of life and death for millions of people around the world. So at this time, the support of all stakeholders is critical to sustaining this fight, including governments, civil society, public and private donors, and communities to step up and fill this gap. And we must prioritize, we must prevent disruptions to TB services. We need to prioritize domestic investment to ensure that equitable and essential TB care is prioritized within national budgets. We need to safeguard critical resources, including essential drugs, diagnostics, and social protections for people with TB. We need to further strengthen partnerships with diverse stakeholders to ensure that we have different funding streams. And we must also enhance monitoring systems so that we can utilize timely data and early warning systems to address disruptions. So let me conclude here, Dr. Madhu, that we are indeed on the brink of a crisis, and it could reverberate across borders and generations if we don't act decisively. 2 years ago, I remember we all declared on the UN stage that we can end TB, but now we really must in this difficult situation. Thank you.
Thank you, Handaa. The reality looks very grim, and we will talk more about potential solutions and how we can push back against what's happening. Deeply appreciate your work and the amount of effort that you put into keeping TB on the global agenda. Melino, you are directly providing TB care and HIV care and services in a high burden country setting like Lesotho. And I know you would be worried not only about the disruptions to TB care, but also disruptions to HIV care, because very often it's the same people who have both infections. So you have this double anxiety, I'm sure, of PEPFAR collapse and also services for TB collapsing. So tell us what you are seeing as a service provider through PIH, and what is the ground realities you are faced with right now?
Yeah, thank you so much, Dr. Madhu. Indeed, the funding cuts are having, is having a devastating impact on TB and HIV service delivery. And we are seeing a negative impact on the entire TB care cascade, from screening, testing, contact tracing, treatment initiation, patient monitoring, follow-up, and support. And this is because hundreds of frontline healthcare workers and technical advisors on program implementation, supply chain, they are no longer working. And we are literally seeing like some of the clinics operating with half of their previous human resources capacity. And as we can imagine, those who are still working are just focusing on emergencies. And this makes, screening substandard, no contact tracing, testing is compromised. And, this is really a very difficult situation. And in Lesotho, we are facing a particular situation where half of the TB patients are co-infected with HIV. And this makes it, very, very difficult, because we need consistent supply of, reagents, medications, to make sure that, we take care of those patients who are, who have even, a lot of comorbidities. And the health system of Lesotho was already overwhelmed by a double burden of disease. Infectious disease, we have a high burden of HIV, high burden of non-communicable diseases. And when you look at the supply chain and the data systems, they have seriously been impacted, in addition to, not having enough human resources to provide direct care to patients. And this is, as a result of this, we see, already a decrease in the TB care detection. And we are going to see this, worsening with time. And when you look at the impact of this, many patients will die because of, diagnosis is not being made. And secondly, we are going to see, resistant strains. We were already seeing, resistant to new drugs like bedaquiline, and other drugs like quinolones and INH, rifampicin. And we are going to see more resistant strains rise and spread across the globe. Just a concrete example. A few days ago, we admitted, we received a patient who visited clinics 9 times before being diagnosed with DRTB. This patient came to our hospital, referred. He was very, very sick. He needed intensive care. He was put on medical oxygen in addition to DRTB treatment. He's now stable, but you can imagine if someone visited clinics 9 times, how many people he might have infected already? So this situation is going to continue because right now the resources are not available. Screening is not done properly. Contact tracing is not done properly, and very soon we'll have a situation where TB will be uncontrolled and will spread across the globe. I think this is a critical moment where the global community needs to join efforts to mobilize resources and stop TB, where it is. Because any delay will be too late. Tomorrow will be too late. I think what we see, like the case, the patient that we are seeing, we are managing at our MDR-TB hospital, it is a clear evidence that more resistance will come, and it will be difficult to manage them. So I will stop here, and we're happy to respond to questions. Thank you.
Thank you, Melino. It's really scary to hear the ground realities. And it's barely been 8 weeks since the new government took over in the United States, and I'm not sure if this goes on for 4 years, what will be left of global health and development as we know it. We have to think creatively on solutions that might come from other parts of the world, not the United States. So, Maria, I'm sure it must be a very distressing period for you as an American to see all of this unfold when you know exactly what TB can do from your own book. And you're also starting to see really crazy stuff like TB outbreaks in Kansas, measles outbreaks in Texas. It's almost like the US is winding the clock back on years of progress. And as a science journalist, this must be truly very demoralizing low point in your career. From what you're seeing on the ground in the United States, how is this unfolding, and what lessons does your book offer in terms of even thinking of how to fight what we are seeing unfold? Thank you.
Yeah, this is a great question. Thank you for having me, and thank you for that question. I want to start with a little anecdote. Recently, I was talking to one of the family members of the nurses in my book about the rise of TB cases, and she's 82, and she said to me, "My aunt is turning over in her grave at all of this, at the rise of TB, at Trump cutting aid for TB programs, and also the scrubbing of Black history." And then she said, "All that's going to do is take us back to those days of injustice at Seaview Hospital." And I thought about that for a long time, and it really struck me because she's right. Tuberculosis has always been about injustice, and the implications of these cuts are also about injustice. And we can't ignore that. Because as you mentioned, we are going backwards in time to take away drugs and mitigation strategies that helped curb diseases, and in the case of measles, almost eradicate them. And now to say, we're going to stop that it hammers on the walls of logic. We know that diseases have no borders, but often they strike the most vulnerable populations. And we saw this with COVID. We saw it in tuberculosis. My whole book is about the vulnerable populations of immigrants who came over and were considered, quote, uncultured, uncouth, un-American. They were seen as second-class citizens, as were the nurses who cared for them. And so the question is, when we think about this injustice, we have to ask, who is going to care for these vulnerable people who get sick? How will they get care? Because now there's all these cuts in Medicaid, and they're talking about cuts in Social Security. So this becomes the injustice against an entire nation. It's the deliberate act of making us all less safe. And that should scare us and outrage us. And it should be a call for all of us to call our senators, despite the fact that people are like, nobody's listening, make those calls. We don't want to return to the days of the Black angels, the days that, the niece of one of the nurses was telling me about. the days when these nurses wash dozens of bodies and hearses pulled up 10 to 12 a day, where people were sick and dying by the thousands, where they were made to feel like they were only the sum of their sickness. What's going to happen? Practically, hospitals are going to fill. The frontline workers who will be called up are going to be in the same compromised positions as they were with COVID. They're going to risk getting sick. And, infections are going to increase. And John said, we're going to start to see mutations. And then what are we going to do? I don't think the world actually realizes how terrifying tuberculosis is. People used to say to me, oh, it's like bronchitis. It's easily curable. It's not that bad. It's called consumption. It was for a reason. It consumes you from the inside out. And so, the problem with tuberculosis is that it takes a long time to replicate. So you could be spreading it without even knowing that you're sick. It's not like measles that replicates, fairly quickly. It takes, for the scientists, once every 24 hours, it mutates. And so it could take months or weeks before the symptoms start showing. The biggest thing that it does is it puts us at a risk for a future health crisis, another pandemic, which we don't want, especially under this administration. To think of going through a second pandemic under this administration with the people that we have in charge and their ideas of public health and how it should be is terrifying. And worse, people are going to die for no reason. And there's going to be collateral damage with frontline workers and with innocent people. And I know this sounds grim and grisly, and later we will give you hope, because there is hope. I do believe that there is hope. But for now, I think we need to really think about what is happening as an injustice, not just to the United States, to the whole entire world, because the US, as John said, has been, has funded so many of these programs that are now being cut. So thank you.
Thank you, Maria. I cannot overemphasize your message that United States itself is now unsafe. It's not just Lesotho is unsafe or the global South countries are unsafe. US is seriously unsafe now because US has turned its back on WHO, on CDC, on NIH, on public health, on science. This isn't just an attack on some groups, it's an attack on science. It's also an attack on diversity, equity, and inclusion. And TB sits at the confluence of the two, right? As you beautifully wrote in your book. So I will not be shocked at all to see TB rates skyrocket in Black communities, in Native American communities, in immigrants, in refugees, and people of color, because those are the ones that invariably get impacted first, as we saw during COVID-19. And US had some of the best access to COVID vaccines during the pandemic, and yet lost 1.1 plus million Americans to COVID. When you don't follow science and when you disrupt public health, that's exactly what happens and what I expect to see happen, whether it's measles or whooping cough or TB, which is all coming back. So sadly, that's the blunt way of saying it. US is making TB great again, polio great again, measles great again. Not quite what people wanted or voted for, I'm sure, but that's what the reality is. Vidya, you have a different perspective. You've written so much about TB in India, which is the world's highest TB burden country. While you may not see the kind of stuff unfolding in the US right now in India, India still has a long ways to go before ending TB. How do you see the current crisis playing out over an already high existing burden within India?
Firstly, thank you for organizing this conversation, because otherwise it just feels like you're screaming into an abyss, because most of the people don't realize tuberculosis is a present and constant threat to all of us. And how does it look? I was reading the same report you mentioned of disruptions that have been caused, the Stop TB report. And first I thought I will go into India and talk about the level of disruptions in treatment and diagnostics and surveillance. But then I saw that's what's happening in 27 countries in 8 weeks' time. And the truth is USAID's main work was in sub-Saharan Africa, Asia, and then some in EU. But what's happened is money that was sucked up during colonial era was being given back to post-colonial nations as aid. And at the moment when things are unraveling, as easy as it is to blame Donald Trump for everything that's upon us, I do think there is merit in slowing down and looking at the long road that has led us to a situation where we are now finding ourselves that the global health policies are being dictated by the CEO of a car company and a free market purist who is using health institutions as weapons. Because over the last 80 years, I do not understand how we found ourselves in this position. 3 years after COVID, most of the post-colonial nations haven't yet emerged from the disaster that COVID was for us. And we are now looking at a situation where so much power was concentrated in one place, and it's like pulled the rug from under post-colonial nations. And it shows how this deliberate dependency on charity was created within global health, when it's really easy for India manufacturers generic medicines and these tests and these surveillance that are all being disrupted. This would not happen if global health order was serving the rest of the world instead of just the global north countries. And I do think we are things are grim, things are grim, but we are well past this point where bad news has to be broken gently, because a lot of people very far away from the US are going to pay the cost for the kind of votes and the domestic politics that has played down in the US. And we cannot have a global health structure that is just held at the whim of leaders of 2 or 3 countries. I can see global South countries go into a huddle. There's so much anger in the conversations that's happening back in India by, activists that I speak to. I feel like there were the only silver lining in this crisis, as everything is falling apart around our ears, is that when we start rebuilding this, we have to ensure that we don't, like, a horse is in the hospital. That's what's happening. A horse is in the hospital, like some comedian said, and no one knows what the horse is going to do in the hospital. We cannot let this happen again, and for that, it's really important for all institutions involved to reckon with their relationship with colonialism, and how we have this thing in health, which Dr. Paul Farmer spoke all the time about, this making cost-effective cure available. That's the kind of bean counters imagination of global health that has got us to this point. And I want to move very quickly on to the next round of questions, because I want to hear from everyone about what they think of where we are as we start rebuilding, because we are not, this is not the end. Things fall apart, but sadly they don't end when they fall apart. So.
Thank you, Vidya. I love the way you connected the current crisis with the colonial past. And why is it that so many countries ended up becoming so reliant on one nation, and how that one nation's action now has catastrophic impacts on people far, far away? I've been seeing lots of interesting, thoughtful pieces. The first wave of pieces that came out when President Trump unleashed all these executive orders was about no, America should absolutely continue to support global health. America is the great power, a great nation. Our science is fabulous. Without us, WHO will collapse. Without us, the PEPFAR and AIDS will finish. And that it's important for US to continue to exercise its power and wield that influence by staying engaged in global health. And much of that came from the perspective of America again. It was a utilitarian, transactional view of the world, right? We should stay involved because we can shape PEPFAR, we can shape WHO. The next wave of pieces was more about, okay, this giant Band-Aid has been ripped off. what can emerge from this ashes, right? Could the global south genuinely take ownership and leadership of their own problems, right? In this case, TB, HIV, malaria, whatnot, start investing their own resources, take control of their agenda, be self-reliant in terms of manufacturing tests or vaccines or other things, and also asking hard questions. Why does a middle income country like Nigeria need US funding for primary care? Why hasn't Nigeria stepped up? That's the kind of heart, soul-searching responses. I mean, Melino, I would like you to weigh in here. I think a lot of African colleagues are very distressed as to why their own nations have not stepped up to protect them, right? And I've seen that all the retired AIDS activists have come back because suddenly they thought they could have retired because HIV was chugging along nicely. Now they're back. So I saw Zaki Ahmed from South Africa, who started the Treatment Action Campaign, post something this week saying that we will not let anyone die of HIV in South Africa, regardless of what the US government said or did. I think that's the spirit we want to see, that no African will be allowed to die just because PEPFAR is disappearing. So I like us now to kind of gently swing towards potential solutions to this crisis. Because yes, it's extraordinarily stressful and grim, and things. I think it's not the end of aid that is necessarily causing distress to people. I think the way it has been done so unilaterally, so violently, and so cruelly, that I think is a genuine. I saw a beautiful piece in the BMJ from African authors saying that uh, the US government consulted no country before making that decision. Nobody who was actually service providers who were receiving the aid, who were involved in the delivery of aid, were consulted. And so this is like I decide tomorrow morning that I'm no longer supporting you and you've not been consulted or informed that this was coming, let alone a transition period, right? If you had said, we will sunset aid in 2 years' time or whatever, get ready, then at least people had a way to plan, people had a way to mobilize resources, make a strategy on how to survive. Now this is like a sudden, shot to your chest with the bullet, and then you have to now figure out how to survive. So it's this violent, non-consultative way of doing, and honestly an unethical way of ending aid, which is what I think is truly distressing, right? It's a textbook on how not to transition away from aid or support. And to see other countries rapidly following, UK has slashed its aid. Several European countries are slashing its aids. And I'm wondering, here are all countries, Europe is a great example. The whole damn continent is built on colonialism and imperialism. That is where much of their wealth comes from. And they think giving away tiny fractions of this, tiny in terms of their GDP, is somehow something great, and cutting that is what their strategy is. Come on. This is like completely nonsensical. It's got nothing to do with the actual amount of money. It's a symbolic gesture to make the voting base happy. It has got no meaningful consequences to their budget. And yet
Also,
they're all in a hurry to do this, cutting aid.
not to mention this very crucial thing that, I know Handa was saying that we can't have history repeat itself. History doesn't repeat itself, but it does follow the same rhythm. All of science research and medical experiments have come out of experiments on black and brown bodies. So I was watching this news report of Bill Gates lobbying the Trump administration for, some sort of ease. I don't know what a waste of time anyway, that's on Bill Gates. But if at this point he truly wants to help, one very good way Bill Gates can help is waive patent protection, waive his patent monopolies on all his HIV and TB in particular. That's one way to go about it. What we are looking at was inevitable because we structured global health in such a way where there was a slight conflation of interest that what is good for the US is good for the rest of the world, which I remember as a history student when this was said of Ford Motors, when Charlie Wilson said what is good for General Motors, sorry, not for General Motors is good for the US. And there was a huge scandal of this conflation of interest. And you know, it is beyond the pale for the US government to do what it does. But then again, it's domestic policy. But when the center doesn't hold and you think you can drag everyone down with you, which is what is happening now, but you know, people do survive things, not everything ends. And the people who will survive will build systems which will, you know, what the US has done is forfeited. First, it conquered all the space in the center and forfeited its space. And now there is a vacuum. As I said, a horse is in the hospital. We don't know how this cookie crumbles because all of us are trying to historify something in real time. It's as it's happening, it's not easy. But what I do know is for sure that, you know, there is this question of hopelessness and despair. A lot of us are born into a culture of resistance. We are not going to roll over and die. And what will come next will involve a lot of these kind of conversation. Even this was not happening 5 years ago during the pandemic. So I don't know.
I know it's been forced upon us. Melino, and then I'll come to you, Maria. Melino, what kind of leadership do you think we can expect to see in Africa? What are you doing personally? You know, there's lots of PIH sites across Africa. What's the strategy to make sure nobody dies of TB or AIDS in this current crisis?
Yeah, thanks, Madhu. Well, we have been working with the government of Lesotho, and also in other sites, our PIH colleagues have been working with the government counterparts to really look at what is the real gap. And you know, already the funding for TB was not enough. According to the recent WHO report, the world needed 22 billion to reach universal health care for TB, but only 6.7 billion were available. So already to make governments understand that there is a huge need in terms of funding TB programs. And this situation is adding, you know, is making the situation worse. So when we worked with when we were working with the Minister of Health leadership, we really showed them the model that works. Really how we should prioritize, you know, the available domestic funding towards a good interventions, meaning really to fund interventions at the primary healthcare level, because you know there are different models. You know, people saying like you should have X-ray machines at the district hospitals, but the reality is TB patients consult first at the health center level. And if you say, okay, go to a district hospital, you know, 20 kilometers away, the TB patients will not be able to go there. So we are telling our government, you know, leadership colleagues to say, hey, this is what is needed. The little resources available, we have to work together to invest at primary healthcare and strengthen the diagnostic capacity at primary healthcare. And this is I have seen the government of Lesotho really taking it, showing, you know, the willingness. Even in this crisis, the government of Lesotho is now trying to absorb the staff who have been laid off and putting them on government payroll. And it's a big commitment, you know, to absorb over 1,500 in a small country like Lesotho. It's a huge it's a huge commitment. And also being willing to work with other donors like Global Fund, World Bank, to really invest at the primary healthcare level and strengthen the diagnostic capacity of primary healthcare facilities. I think this is the way to go.
Thank you, Melino. I fully agree with you. Absolutely, high TB burden in HIV countries need to find the money from their own domestic pockets for now to prevent devastating epidemic of deaths. And that's why I was happy to see South Africa basically stand up and say, yes, we're going to make sure nobody dies of HIV or TB in South Africa. I can see that Nigeria has increased its investment as a response to this. I think integrating, as you said, TV services into primary care and not have many vertical programs to worry about is another way we can get more cost efficiency, I think. I would also like, hopefully, and I was in India recently, I've been thinking, is there a way for greater South-South solidarity during this crisis? For example, if India can give generic HIV medicines to Africa in this crisis, or transfer the technology, or support Africa to manufacture generic ARVs, those are all creative ways of surviving this crisis. Maria, you want to suggest a potential? Quite a few people in the chat box are asking Maria what they can do about it.
Yeah.
Do you have any concrete suggestions, calling Congress people or senators, or
Yeah.
kind of what suggestions would you offer them?
So I think beyond that, it's something that Vidya said that really struck me, this idea that we were trying to historify something in real time. And that is really hard to do. We did that. We tried to do that with COVID in a way. But, for me, it took me a long time. It took me 8 years to write that book and to write the book that I wrote. And one of the things that I've learned is that humanity has been here before, with disease, with war, with cruel administrations who believe that some lives are more worthy than others. And there has been collateral damage, but human beings have prevailed because we fundamentally, at heart, want to survive. We want to live. We want to make the world a better place for those who come after us. And I think about the nurses in my book and how they prevailed. And, people ask me, like, how did they do it? How did they do it? And from talking to the families, it comes down to one thing. It's they bore witness to such detestable and appalling injustices that they decided they did not want to live that way. And they didn't want their ancestors, they didn't want their younger sisters or their families or their children to live that way. So what does that mean? I think of my experience in grad school. I studied with Dr. Elie Wiesel, Auschwitz survivor. And I remember he came into the classroom, he rolled up his sleeve and he showed us his tattoo. And he said to us, now you have bore witness and you cannot turn away from what you saw. And you have a moral obligation as a human being to right injustices when you see them, hear them, or read them. And I think this is where we are right now. What can we do as private citizens? Anybody on this call, in a way, has borne witness to what we say and to the different injustices and sufferings that we talked about. Does that mean go out and start a revolution? Maybe. But at the most basic level, what you can do is say to somebody, hey, I heard this today, and this is wrong. And what can we do in our own community? On a grander level, learn history. It matters. The reason that I think the United States in so many layers of history has not progressed is because we've never faced it. We've never looked history in the eye, at least in the context of my book, and said, what did we do to these people who had tuberculosis? What did we do to these Black nurses that we shoved on the front lines and said, we put them in CVU because, quote, in 20 years, we won't have a color problem in America because they'll all be dead from tuberculosis. That came from the president of hospitals. And so in the end, these women hoped for a world where equity and compassion, morality and love and bearing witness was the guiding principle. And if there's something that we can learn from them, it is that. And that's kind of my TED Talk for today. But I think that's where we can draw hope, in the fact that we can collectively come together and look at how change had been made and bear witness to what's happening now.
Thank you, Maria. That was phenomenal. Yes, we are bearing witness. And when we write books or we write op-eds or we put out tweets on, we don't want to support Twitter anymore, but if we post somewhere else, this is what we're trying to do. We're trying to say, this is the devastation that's happening. This is why it's happening. And it may or may not change hearts and minds of people in the White House, but we continue to make those statements because we must. Handaa, do you have anything that you would like to offer as a potential solution for the short-term crisis, but also thinking longer term on what your desired vision for TB would look like if we can survive this current crisis?
Yeah, thank you, Madhu and colleagues. In the short term, I think it's really important, of course, to fill the gap. And this is where we need other donor nations to step up. So I see in the chat colleagues mentioning, what about people not in the US? What can we do, right? So how can you engage your decision makers in your country to help raise contributions, for example, in this current situation? How can you raise awareness in your country to increase exposure of this topic in your country, for example? So these are the questions that you should be asking in terms of how can other donor nations can step up outside of United States. Also, as private citizens and how can you contribute personally as well in terms of in-kind or other types of support? How can you perhaps if you work in the private sector, how can you help support CSR, corporate social responsibility initiatives to be a contributor in this crisis, for example? So I think thinking through, and of course the domestic budgets and domestic resources, as Dr. Melino mentioned, is important to address this immediate gap. I think that's really important priority so that people don't die of tuberculosis just because of this abrupt decision that someone wakes up in the morning and makes that decision. In the medium to longer term, I think that's where we really need to think through the creative aspects. How can we change the actual funding model to be more independent, right? Someone left a question in the chat as well. How can we change this model? Like, I know in some countries there's already debt for health swaps. That's a really innovative way, for example, to fund these kind of initiatives. South-South solidarity, social enterprises, where it generates revenue to make sure it's sustainable, for example, so that way aid dependency is reduced and it's just the icing on the cake, for example. So I think medium to longer term, we need to think through these creative models so that we don't experience this kind of cruelty in the future administrations. Thank you, and over.
I think it's pretty clear to me now that not just the United States, global North itself, by and large, is abdicating its responsibility, let alone do reparations for colonial damages. We're not even close to that, anywhere close to that. And withdrawal from all forms of multilateralism, right? Withdrawal from WHO, withdrawal from the Paris Agreement for climate crisis, essentially not endorsing sustainable development goals anymore. So it seems like if each country goes into make America great again, make India great again, make UK great again, you are left wondering who is now fighting for humanity as a whole. If it's all retracting to ourselves and then building more borders and walls and each one imposing tariffs on the other, which is a whole another bullshit stuff that's happening. I can't even wrap my head around. I'll impose a tariff on Vidya. Vidya imposes it on me. We each pay more money for whatever we are doing. I mean, there's no end to this insanity, right? So the question now is, as bad as things are, and I have to tell you, as I'm sure you are all are, I haven't really slept properly in 8 weeks now because I'm doom scrolling at night. My head is exploding. I'm ranting on social media. I'm losing it. And so, I had asked a few people when Paul's third death anniversary was coming up. Somebody said, "Can you write something about Paul?" So I had asked the same question that somebody in the chat box did. If Paul were alive today, what would he have said about his insanity? And I wrote a piece. I interviewed lots of people, including Melino, and I posted my piece on the chat box. I think it was shiningly clear that people who had worked with Paul had a few things that they all consistently said to me. That Paul would have been distressed, but Paul would have told us that we cannot afford to despair on behalf of people who really don't have much, right? In other words, if you have any privilege and if you give up, right? If you give up on something, then what about people who don't have the choice? They are just so caught up in their circumstances. You can't give up on behalf of others. So not yielding to despair and finding ways to keep going and resisting in some way, whether that resistance comes from bearing witness, that resistance comes from ranting on webinars like this, whatever it is that we want to do, we all have to come up with something. We have to dig deep, find ways of optimism. So the last few minutes, I want each of you to just say one thing where you intend to find hope, or one person or institution or initiative that is giving you some hope, so that we leave the audience and ourselves with some clarity on what we want to do during this extraordinary situation. Let's start with you, Vidya. What's giving you hope, or where do you think we should find hope?
You know, hope and optimism is generally not my brand. But I will give it a the thing is the implicit in that question. I was talking to John at his book launch, and I said the same thing. Implicit in that question of what would you do? What do you do for hope? Is this assumption that there is an option number two? Because you know, we are not being brave or courageous or hopeful. This is life right now. You get up and you try to survive one day after another, and you do it. You know, we've done this before and we will do it again. I feel like right now what's happening for once and for all is this answer, especially in India. This happened in 2014 after BJP came to power, about how scientists wanted science to be pure and away from, you know, let's not make it political. For now, we have a clear answer of how political health actually is right now. And I believe at this point, you know, not all battles are fought for victory. Some battles are just fought to say that, you know, there was someone out there and that person was fighting. So everyone knows in the future that not everyone agreed with what was being done. And it doesn't even matter whether you win or like where I head back to India in 2 days. And to me, it's almost you like hopelessness is a luxury I don't have. You know, there are people doing far worse and still going out and fighting. And I actually, this is my job. You know, I have to bear witness and write a story so people, maybe there will be lessons for future TB scholars to not do this kind of funding model that we've gotten stuck in. Uh, but I don't think hope is not a problem for me. This is a fight, and it's time to kind of march in and, you know, do your best.
Thank you, Vidya. That was ridiculously impressive and inspiring, I must say. Okay. Over to you, Maria. How do you find hope in this period?
I think Vidya basically said exactly what I was going to say, but you know what, I will add that, you know, for me, living in the United States, I have a young daughter who, you know, went through the first Trump administration and the pandemic. Not really, she was 8 and 9, you know, so she wasn't like savvy. Now she turned 14 and she's going to high school, and they know, and they come home and they're afraid. And, you know, this whole generation grew up, you know, hiding under desks because of gun violence. You know, there's these attacks on their bodies, and, you know, you curl up in bed at night, you doom scroll, you cry, you do whatever you do, then you get up in the morning. And I am privileged enough to be able to use my voice to reach people, to talk to them about public health, infectious disease, about history, about what it means. If you are complacent when you bear witness and you say nothing, you are complicit. And, you know, history will judge you at some point. Maybe you will not be alive. And I'm not talking about some, you know, going to hell or heaven. I am talking about how history will look at the people, like the people that remained silent during the Holocaust or any other genocides. And so right now, if people can use their voice, even in the smallest way, even in their own community, to their neighbor, to whatever, to just say, this is not okay. Let's be angry together. And then let's get up the next day and do what adults do. You know, we're tired, but we get up and we do it. And it's the best that I can do right now, because these 8 weeks have been some of the longest 8 weeks of my life. And we got 4 more years of this. So, you know, I don't know if that's the most hopeful message in the world, but it's something.
No, it is, Maria. It really is. And you, I'm sure, as an American, have a lot of anguish inside you, because you're seeing so many things that is good and great about America. I mean, I studied in America. There's so much good and great, and we should not confuse a few people with the rest of the country, right? So there's a lot of Americans there who are absolutely heartbroken, who are beyond outraged, and want to do something to rectify this madness. So you represent the best of America, Maria, and I think you should continue to do exactly what you're doing. Handaa, where do you find hope, and what would you suggest to all of us?
Thank you. Yeah, I often think about my own experience. I was sick with TB about 15 years ago, so I often think about my time when I was struggling with tuberculosis, and especially during these times of difficult circumstances as a TB advocate now, I think about what could have happened if people like yourselves, if people who are in the audience, if people who are fighting for more funding, more research, more effective support and all that, if they all had given up, then I wouldn't be alive here today. And just knowing that there are millions of Handas out there who need help, that pushes me. Thank you.
Thank you, Handaa. That is very inspiring. Melino, final thoughts?
Yeah, thank you, Madhu. Yes, I have hope. I have hope that one day we will eradicate TB. And this hope comes from what we have been doing as, clinicians and frontline service providers. In the past 3 years, we decided to, to think outside the box and introduced new medical technologies in rural hard-to-reach clinics, including use of artificial intelligence, teleradiology systems, TB Hunter system, and really in the decentralization of molecular tests for TB. And we have seen an increase of TB detection from 37% to 93%. That gives me huge hope that one day, if we think outside the box and really think about investing at primary health care and integrate services, it is possible to achieve TB elimination. Another thing that makes me really hopeful is we have been really struggling to receive patients who are at the very advanced stage. There is one patient who was admitted in our MDR-TB in May last year. This patient spent 37 days on mechanical ventilation in our MDR-TB. And this patient recovered after 6 months in our intensive care unit. This patient was discharged, he recovered. And this was because diagnosis was made late. But even if the diagnosis was made late, he recovered. So these two stories of really strengthening primary healthcare facilities and bringing diagnostics and medical technologies at the lower level of care where patients are in need, and investing in infrastructure to improve treatment outcome, like what has happened to our friend and patient Junkie, it makes me really hopeful. And I think one day we'll eliminate TB. Thank you.
Thank you, Melino. You represent the best of PIH and all the hard work that PIHers do all over the world, including the army of community health workers who are consistently doing the right thing. So I want to close this webinar by saying that, firstly, I wish we had more time. I have so many questions for all of you that I would have loved. And certainly we should all meet someday soon and then have a drink and drown our sorrows, but also hug each other and cry, but also find ways to move forward. At a time when we are almost feeling made to feel guilty for caring about others, right? That words like equity are a bad word now. Diversity is a bad word now. I mean, what the actual heck? These are all the best of human traits, right? I don't care what this attack on wokeness is and all that stuff is coming from. But I want to almost go back and say we need to make compassion great again, that caring for others is absolutely a normal default position, right? It is not an extraordinary position that human beings are built to have compassion for others. And that's how we are even here in the first place, right? If we had no compassion for each other, human species would have gone extinct centuries ago. So I think we have to go back to first principles and say, we totally worry about what's happening in Lesotho right now. We must. Or we worry about what's happening in Gaza or Sudan or wherever it is. And we should not apologize for it, that we should not be self-censoring ourselves for caring, for being compassionate. And whether it's TB or whether it's HIV or whether it's, gender violence, all of that are important issues that we need to keep fighting for. So I think we need to find many, many more like-minded communities, people where we can speak freely, where we don't have to censor which words we're using, where we can genuinely go back to first principles, that compassion is what's missing in the world right now. And it's being rapidly taken away from us. We are being punished for being compassionate. And that is absolutely outrageous, that we truly should make compassion great again. That's how we're going to rediscover our humanity, which is rapidly being eroded and lost. And global solidarity should not be an afterthought. Equity should not be an afterthought. As Paul consistently told us, global health means nothing without equity. And it is equity that we are fighting for here, right? As much as we will all be impacted ourselves, it's the most vulnerable people that are going to get hit by everything that the Trump administration is doing right now. So let's work hard to make compassion great again, and not apologize for any of the core principles that we believe in. We're not going to apologize for science. I'm so done with defending science to idiots, right? That is not what we're going to do. I'm not going to bend backwards just because somebody wants me to remove climate change from my grant and replace it with some other nonsensical term. I think we should resist by giving up on all of these outrageous things that are being asked of us, and instead go back to first principles and say, we are not abandoning science, we're not abandoning equity. We care about compassion. We care about reaching people who have not been reached. That is the only way to fight these sorts of completely insane evil forces that are darkening. So I have to end by quoting Professor Albus Dumbledore, one of my heroes. He said, even in the darkest of times, one can always find light if only we remember to turn on the lights, right? So something like that. So I think each of us has a tiny light. Some of us have bigger lights than others, but that whatever that tiny light may be, which is right now at risk of burning out, or it's struggling to stay alive, we got to turn it on, so that if enough lights turn on, that is how we'll beat back the darkness. So thank you so much to all of you. I'm so grateful. You're all wonderful people. I hope we can repeat this kind of a panel at the union conference, which was my suggestion to the union, and also have John join us there as well. And Heather and the entire team from PIH, they have been spectacular in putting this together. We will post this online, and hopefully we'll share with others who are also looking for hope in these difficult periods. Thank you so much.